With me now to talk more about the controversy surrounding electronic cigarettes and vaping is Matthew Myers. He's president of the Campaign for Tobacco-Free Kids. President Myers, thank you so much for joining us tonight to talk about this very important issue. First of all, can you give us a big picture of where we are, the impact of e-cigarettes impacting people, especially the youth?
Well, despite the claims of the e-cigarette industry, particularly Juul, that their target is adults, when they introduced these products, they did it with imagery very similar to the imagery that tobacco companies use to attract Juul. And they introduced them with the kind of sweet flavors that mask the harshness, mask the harm of the product. So what we've seen in the United States in the last 3 years is an explosive growth of e-cigarette use among youth, even while we've seen no growth in e-cigarette use among adults. What we're also seeing is that while we had made decades of progress in reducing smoking among our kids, in the last 3 years, we've seen a greater growth of the number of kids who are addicted to nicotine than we've had in any time in the last 20 years. So what we're finding is great promises that these products may be helpful to smokers to quit. No evidence that that's true. Enormous evidence that as these products have been manufactured, marketed, and sales, they've created an epidemic of youth use among kids. And we have to remember, for kids, delivering massive doses of nicotine is itself harmful.
So being advertised as helping people quit smoking, but in reality, it got more young people addicted to this. How did this come about?
Well, unfortunately, it came about by a combination of unfortunate events. The first is companies who clearly targeted kids. They used rhetoric to lull us into a sleep, and they used social media advertising, introduced flavors that appeal to kids, designs to make the product seem cool. And at the same time, candidly, our government was completely asleep at the switch. We have laws that should have required these companies to provide these products for review and approval by the U.S. Food and Drug Administration for safety, for evidence that it actually would help smokers quit, and for proof that it wouldn't lure kids into use. The FDA simply didn't enforce the law.
And I know you have been, lobbying for or advocating for tobacco control for decades. Can you talk to us about what, in your opinion, should government and the regulators do at this point?
I think everybody should learn from the U.S. lesson. In the absence of strict government regulation, whatever the e-cigarette companies say, they're going to maximize their profit by maximizing the population that uses them, and in this case, it's kids. If government doesn't act very quickly and very strongly to prevent these products from being advertised in ways to appeal to kids, to eliminate all the flavors that we know attract kids, and to regulate these products for health and safety, you can expect to see what the United States did. It makes sense, therefore, for a country like India, where a very small percentage of the population smokes cigarettes, but there's a very large youthful population that would be the target, to step into and say, as they have this week, to say, you may not sell these products unless you go through our normal drug approval process. And that's what India did, and it makes enormous sense in that context.
But specifically here in the U.S., we heard the president speaking about the issue. Senators are reportedly drafting legislation about this issue. What should be done next, in your opinion?
In the United States, there's a couple of steps that should be done and be done quickly. First, all the flavored products should be taken off the shelves immediately. They are what is fueling the epidemic among our nation's youth. Second, we should raise the age of sale of any tobacco product to 21. Third, we need to educate our children much more. And fourth, FDA, our Food and Drug Administration, needs to enforce the law that says none of these products should be sold until they're reviewed by a government agency for both health, safety, and appeal to kids.
And finally, what about the economic consequences? We heard about the complaints of tobacco farmers and their community. What are they going to do?
Well, we need to talk about the economic consequences of the fact that 5 million American kids are addicted. We're going to have to deal with those addictions. We're going to have to deal with the healthcare costs as a result of those addictions. That will far exceed anything that this industry is contributing to the health of our economy.
Matthew Myers, president of the Campaign for Tobacco-Free Kids, thank you so much for your insight.